Welcome, everyone. We're so glad that you all are here with us this morning. We'll get started in just a minute. My name is Dion Kokorapia, and I will be moderating this session today. But I just want to go over and review a few items before we get started with our presentation. We'd like to start off by reminding everyone of our commitment to maintaining a safe and accountable space. If you experience issues or need assistance, please reach out to me by sending me a direct message found at the top of the right-hand corner of the event icon bar at the top of your screen. And then I'm just going to walk you through some of the tools that we're going to use during this session. And I'd like to first draw your attention to the vertical bar. There's a vertical bar to the right of your screen. Those are the session icons. This is how you will access different resources, the chat box, the question and answer section for this session. And there's also an event feed bar at the very top of the screen. The background is a light blue. That's how you access tools for the actual larger event. But for the purposes of our presentation today, you're going to focus on that vertical bar. And if you look at that bar, you'll see that the first icon is the chat bar. So you want to click on that to add messages to the chat. The next one is the Q&A, and I want to ask you all to please use the Q&A icon to send questions to the presenters. If you put the questions in the chat, because there's so many people present, the chat moves very quickly, so we may miss some of the questions. So please add all of your questions using that Q&A icon. The next icon will allow you to see others who are also in the session. And then we have our polls icon. If the presenters want to do a poll, you'll find that poll here. The next is the breakout room. If we're using breakout rooms, you'll find the information regarding the breakout rooms under that icon. And then the next one is looks like 2 sheets of paper there. That's where you can find all of the resources for this session. And you'll be able to find the speaker slides and any other resources that were provided. So please use this vertical bar to access the icons. And again, just want to remind you all to please use that Q&A tab and not the chat tab to ask questions. And if at any time during the session you need a break, you need to step away, you need to decompress, please feel free to do so. And you're welcome to join our wellness room. We have wellness rooms open throughout the day. So join the wellness room by using the tab at the top left of our screen, and then one of our team members will meet you there. And so now it is my pleasure to introduce our speakers for today. We first have Jeremiah Mitchell, who is a current student at Morehouse College and the owner of Pebble Entertainment. He is also an advisory council member with this project that they're going to be speaking about today. Then we have Malaka Nzinga, who is a program coordinator with the project. She is an experienced public health professional with over 6 years of educational and professional experience in public health education and promotion. Our next presenter is Michaela Kendall, who is a pre-medical student aspiring to cultivate systematic changes in healthcare disparities for minorities as a physician. She is on the advisory council support for youth adult power sharing, also at Morehouse, and a member of this project. And then we have Laolu Ogunye, who is, well, I'm so excited that we also have a high school student joining us today. He's a senior at Decatur High School. He is an outspoken advocate, a varsity basketball player, and has aspirations to help solve world issues using computer science and engineering. Thank you all so much for joining us today. We're so excited for your presentation, and I'll turn the stage over to you.
Thank you so much for that introduction. Again, my name is Malaka Nzinga, and I'll allow my fellow panelists to introduce themselves again as well.
My name is Michaela Kendall.
My name is Jeremiah Mitchell.
My name is Lalo Ogane.
And today we're here to talk to you about amplifying youth voice, youth adult partnerships to promote Black youth mental health in Georgia. We have no conflicts of interest to disclose. And this is our funding acknowledgement from the Office of Minority Health. By the end of this session, attendees will be able to define key terms related to youth engagement, including youth voice, youth-led, youth-engaged, youth-informed, and youth adult partnership, discuss the importance of youth-driven outcomes to inform research, policy, and practices that promote Black youth mental health, and describe an approach to developing a youth adult partnership advisory council. My name is Malika Nzinga. I'm a program coordinator at Morehouse School of Medicine in the Research and Policy Division and the National Center for Primary Care.
My name is Michaela Kendall, and I am a facilitator at Vox ATL, and we are community partners with Morehouse School of Medicine.
My name is Lalo Ogane, and I'm a senior at Decatur High School. I'm a part of the Black Youth Mental Health Advisory Council.
This is a project funded by the Office of Minority Health to find innovative policy solutions that promote Black youth mental health in the state of Georgia. So I wasn't fully a part of the proposal that came on after it was already started, but inspired to be a part of this work or a part of this project because of personal experience with mental health. I lost my dad in 2021, and I have a younger sister in high school. The lack of support within her school to, help her for coping mechanisms, just general support, and honestly, like the lack of empathy.
A lot of my activism has been geared around mental health. And one thing that's really important to me is Black youth mental health. So when I had the opportunity at Vox to jump onto this project, I could not say no. Black youth mental health is so important to me because I feel as if when I was a child, there was a lot of stigma in my family regarding mental health. It wasn't something we really talked about, but the first step to facing some of those issues that we find within the Black community is to talk about it.
This project to me is an opportunity for everybody in Atlanta, and further than that, everybody in Georgia, to get a better overview of Black youth mental health, the space of Black youth mental health, and create policy around Black youth mental health, making sure that we give a better platform for the next generation. When I first joined, going to the first meeting, it was a bit nerve-wracking. It was a bit strenuous. I went there, but I walked in and it was actually a great space in terms of them de-jargoning everything, being super open and welcome.
Vox ATL, as a nonprofit organization that already focuses on youth voice and youth engagement, already had some tools in place. We have things in place that ensure that youth voice is heard. It was really adjusting to, okay, how does this look with adults who have not necessarily been in the same place as Vox? And what did the advisory council need in order for youth to be able to feel comfortable sharing their voice?
As I started to matriculate into the council, there were definitely a couple of small problems that I faced. The first one being kind of a little bit of uncertainty in terms of what exactly the process was for getting things implemented from our mouths to the real world. However, that's been kind of cleared up as I've asked a few questions throughout the project. I think that the youth adult engagement throughout this project has been absolutely amazing. I think that every time that we're discussing any type of topic, they make sure to reach out to at least one youth for their opinions on the position. They ask about different topics and different subjects, making sure that we all have an understanding of what everything is.
And a lot of times once you're, removed from some generations, you're not really understanding what the climate for young people is looking like. So that's where we have the adults bringing to the table, what is it looking like in the broad scope? And the young people are able to bring to the table, okay, how is this going to look in my everyday life? And will it be feasible in that way?
Building the relationships with our partner organizations, with the advisory council, with the youth that have been involved in this project, and helping us to spearhead a lot of our decisions that we've made. I think that's been the best part. And really the intentionality of including youth voices and making sure that they're at the forefront has been like the best part of this project.
When you're looking at trying to build policies for Black youth mental health, it is very important to, as I mentioned before, combine those lived experiences and learned experiences. Yeah, I think the best part of this project is seeing that there are people who are actively working towards the things that I advocate for every day.
Working with youth and adults that share the same sentiment as I do is honestly an exhilarating and incredible experience. Seeing so many people in a room that actually care about youth, and they do it farther than just their mouths, but they put their money where their mouth is. They go out into the world and they really make change. It's an incredible experience. It shows me that, there's a lot of hope for the youth mental health space, especially the Black youth mental health space.
Okay.
I want to shout out to Jeremiah for that amazing video. And yep, I'll pass to you, Michaela, to get us started with the go around.
Yes, amazing video that Jeremiah literally produced for us. A good way of how multimedia content can be used for youth expression, just to plug that real quick. But let's get into one of my favorite traditions that we hold at Vox, which is the go around question. And you might be asking yourself, what is the go around question? Well, at the start of every advisory council meeting, we go around and all the advisory council members answer a go around question, introducing themselves and trying to connect with each other with just like a mini icebreaker. And the importance of this when we're talking about youth engagement and intergenerational connections is that this allows everyone to speak at the beginning. A lot of times we'll see when young people are in a room full of adults, they might not feel as comfortable to share their voice. But once you introduce that go around question and have everybody speak at the beginning, you're going to be more comfortable as that young person or even as an adult to speak on later on. And you'll even be more comfortable to connect with your other advisory council members or that student or that child that you are trying to help. And this also is a great way of leveling the playing field when we're talking about youth adult power sharing. So our go around question for today, and although we can't go around in the typical circle that we are going to do, our go around question is, what is your favorite board or card game? And we're actually going to use the Mentimeter that Mally has shared in the chat. So if you can click on that link, it will take you to a Menti and you can put in your answer. Like, for example, I would say, hi, my name is Michaela Kendall. I'm 19. My pronouns are she, her, and my favorite card game is Uno. And please, could I get some acknowledgement in the chat that the Menti link is working? Perfect. And also, as I've worked through Vox, I've been able to use those go around questions and their answers to later connect with teens. Like if we haven't heard from a teen in a while, then I could reach out and be like, hey, you mentioned that one time that you really love track. How's that been going? And that kind of gives a connection to the teen through that one answer to the question. Okay, now that we can see some of our answers generated, I see someone said spades. I do love a game of spades, but it also causes a lot of problems in my family, kind of like Uno. Monopoly also causes a lot of problems. Heads up. Great. So yeah, like I mentioned before, we would typically all take this opportunity to share out so that we can hear everybody talk in the beginning. But because of the space we're in now, we had to readjust. But this has now given me a connection to you all and a connection that you now have to me. And I'll pass it back to Mally.
Thank you, Michaela. So I'll just talk a little bit more about the background of our project. So we are funded by the Office of Minority Health to implement and evaluate the effect of innovative policy solutions that promote positive Black youth mental outcomes in the state of Georgia. And we are one of 8 funded programs and the only one in Georgia. Excuse my puppy if you hear him. Our population of focus for this project are Black youth in the state of Georgia. There are over 600,000 Black youth enrolled in schools within 13 rural counties that are predominantly Black populations. Some of the mental health inequities we looked at included key statistics, including ACE statistics, with 3 of 5 Georgia youth experiencing at least one adverse childhood experience, and white Georgia youth being 8 times more likely to experience 0. The Georgia Student Health Survey showed us that Black students have a higher percentage for attempted suicide, and the Department of Juvenile Justice reports facilities having 70% of their youth with mental health diagnoses severe enough to require ongoing treatment. Some of our policy areas of focus that we looked at included mental health treatment, suicide prevention, and school discipline. A key statistic in the category of school discipline being the disproportion in disciplinary actions for Black students in comparison to white students, even when their behaviors were similar. And I wanted to take time to highlight our amazing partners and advisory council organizations. We have 3 partner organizations: Vox ATL, supporting youth engagement; the Georgia Health Policy Center, assisting with evaluation; and the Voices for Georgia's Children, helping with the policy work and project management. And some of the organizations that are represented on our advisory council include Ignite, the Department of Behavioral Health and Developmental Disabilities, the Georgia Council for Adolescent Power and Potential, and the Georgia Statewide After School Network. The idea of our youth engagement model came about, and it began with extensive literature reviews looking at our policies related to the key areas of focus. And from there, we met with our partner organizations to decide on an engagement model from the project. And youth engagement rose to the top as a major priority, and we knew that we wanted that to be at the center of our project. We decided on equal representation of youth and adult council members and relied on the guidance from our partner organization, Vox ATL, to build and help create a youth adult power sharing curriculum that would educate everyone on what this could look like. We were very innovative in our approach to have youth involved in every step of the policymaking process from the beginning. We wanted to highlight those mutual benefits to the youth and adult council members to gain valuable insight and connect through lived experiences. And place an emphasis on a meaningful youth voice and the encouragement of youth to be able to provide opinions about issues related to them. And literature showed us Hart's ladder of youth participation, as you can see on the side here. And we wanted to avoid those lower levels of the ladder, including tokenism and decoration, and really aim for those higher degrees of participation. And I can confidently say that we are at adult initiated and shared decision-making with youth. When we were building our council, we decided on shared decision-making among youth and adults to shift the power from being solely in the hands of the adults. And this meant equal representation of both parties on our council. And some of the requirements or things that we asked for our council members to be included in included youth, generally between the ages of 16 to 19, who had leadership experience in community organizations and lived experience discussing mental health and identifying as Black youth. For the adults, we were looking for those who are in the fields of behavioral health or youth development and youth advocacy in Georgia. Some of the things that we asked our council members to commit to included helping to identify innovative policy solutions, partner sites, prioritize their own health and well-being as well as others, which was amazing insight from our Vox teams, and power sharing, consensus building, and lastly, to engage and attend in monthly, in quotations, virtual, because sometimes we meet in person. And from here, I'll pass it to Michaela to tell you more about why youth voice is so important.
Sorry, I was lost in virtual space for a second there, but I'm back. Again, I think we can all agree that it's very important to involve the voices of the individuals and the groups that you are looking to serve. Like, both of my parents are teachers, and every day, although it might be a struggle for them, they try to include their students' voices and not just what the district needs from them. So what this work has really been focusing on is making sure that we're actively including the voices of young Black people, because how can you not include young Black people when you're talking about Black youth mental health? So yes, there is that moral imperative to really make sure that the voices of young Black people are being centered, and because they're the ones being impacted with things going on in their community regarding mental health. But we also know that including those lived experiences also brings other benefits, such as the positive outcomes and impacts for those individuals and stronger programs in communities. So the importance of this lived experience is kind of why there are two things that are being brought to the table by the youth and the adults on the advisory council. So like I said before, the young people are bringing those lived experiences. So they're quite literally on the ground in their schools, in their after school programming, and they are experiencing everything that the adults are actively researching and collecting statistics on and trying to improve. So as the young people bring those lived experiences, the adults can really bring those learned experiences of, oh, this has been prior policy, or this is how the school district works, and this is how, we could leverage this system to help you. So it's kind of bringing those two experiences to the table in order to help each other. And to share a little bit more about how we actually got young people engaged into the process, we started off by really defining, okay, what is the actual job description of those on the advisory council? And then we moved into universal definitions, and those are actually defining, okay, what do we actually want youth engagement to mean? Mally mentioned earlier about the ladder of participation for youth. We really wanted to make sure that although this was an adult initiated project, that youth were actively informed in providing their input onto the project as well. But I would say the most important part of this piece was the power sharing trainings that I'll touch on a little bit more in the next slide. But we also made sure that we had youth-led focus groups. And with that, we provided youth training for those focus groups, and we had facilitator guides. And we've also made sure to implement certain things into our advisory council meetings for the higher yield of engagement. And now I'll talk a little bit more about the power sharing trainings. So we had the power sharing trainings divided into 3 parts. So our first training was just with the adults. And although these are adults that are actively working to improve the lives of young Black people, it is just kind of natural and human that over the course of time, you start to collect some biases. These biases, of course, can be, whether they're implicit or explicit, we always hear that phrase, children are to be seen and not heard. And over time, adults kind of collect that and it's ingrained in their brain because of society or whatever have you. And so we really, in those trainings, focused on how do we confront those biases moving forward so they are not affecting the work or affecting how youth are actually actively engaged into the process. And another thing we talked about in the adult training was the importance of actually agreeing and consent. And when we're talking about that, we wanted to make sure that adults weren't pushing youth into a certain decision. And so on the flip coin of that, we had our youth only training. And just like adults, young people are also internalizing those biases of children are to be seen and not heard, or you are the leaders of the future. But at Vox, one of the important things that we wanted to bring to the table was really instilling in the youth that they are the leaders of today, and they don't have to wait to necessarily turn 18 to become a leader, that they have the power to use their voice in this council to make a difference. So we talked a lot about the importance of knowing that you deserve a spot at the table and your voice is needed. It's not just requested. We need to know your opinion. We need to know how this would impact you. We need to know, would this actually be a beneficial policy in your life? And so we really talked about that with the youth and really trying to gear them to, hey, you're going to be in a room full of adults that, yes, they've done the research. Yes, they have those learned experiences, but you are also bringing something important to the table. And it's important not to let yourself just kind of agree with something because you feel as if the adults know better, but also make sure that you actually have consent on an agreement to what's being decided on the advisory council. And then we came together as youth and adults, and there are 3 important things that we shared. The first thing was everybody stated their why. Why are you on this council? Why is Black youth mental health important to you? And from there, we were really able to create common goals with each other and really come to understand, okay, we are working towards the same thing. And just like the go-around question, stating what your why is really levels the playing field because, again, you're taking it so that everybody's working towards the same thing. And then we went through confronting the biases together that we see. And that bias we often call adultism, and that is the thought that young people are lazy, not hardworking. So we really confronted that and tried to get the adult and the youth on the same level with that. And then the last important thing that we did was we came up with ground rules. So ground rules at Vox, we like to call them our group agreements. Ground rules allow everybody to feel comfortable and respected in the space that they are in. So for the advisory council, a lot of their ground rules were geared towards how can we make sure that this is actually youth adult power sharing and not just kind of adult led with the youth being strung along. So some of the ground rules that we had were de-jargoning. This one has been very important because the adults are coming with a lot of jargon because in their everyday work, they're using abbreviations, they're using certain things that the youth might not know what that means. So it was very important to, again, level that playing field by saying, okay, we're not going to accidentally exclude the young people from the conversation by using language they haven't necessarily learned yet. Yes, and as someone pointed out, some adults don't understand all the jargon anyways, especially when the advisory council, it's adults coming from different organizations, so different places of work. So it was very important that we hold de-jargon. Another one is releasing the titles. Again, kind of leveling that playing field. Yes, I'm so happy you got your degree, but I have something to bring to the table as well. Now, in the spirit of still keeping this interactive, just like we would do at any advisory council meeting, with the platform we have, we're going to share another Mentimeter with you, just for you all to share which one of these ground rules really resonates with you, or one that you have questions about. And Mally's dropped the link for that again in the chat. Oh, and another thing I want to mention, these ground rules weren't just something we came up with at the trainings and never looked at again. Every single advisory council meeting, we take a look at these ground rules again. And actually, just yesterday, we had another ground rule added to our group agreements, because we like to call the ground rules a living, breathing document, in which, you know, because we're a living, breathing group, we need to be able to be flexible with what everybody needs going forward. So I see 2D jargons. Yes, holding each other accountable. That one has also been really important. Keep it real. That one got shouted out yesterday when we re-looked at our ground rules. Be present. That one's been very important, especially holding advisory council meetings on Zoom. So, and then no blaming or shaming. Perfect. Thank you everyone for participating in another Mentimeter. All right. So just to wrap it up, so there's been 3 important aspects, or the organizations that have been brought to the table for this advisory council. We have Morehouse School of Medicine, that are really the holders of the research, so they provide the research support. And then we have Voices, which they provide the support for policy, and they've really taken charge in leading that policy assessment framework. And then we have my organization that I'm with, Vox ATL, which really focuses on youth engagement support. And I will say that each and every single one of these pieces has been integral to this process. And even as I was being introduced to this, I was also, as a young person, oriented to the work before I just kind of dived right in. And that was the importance of the trainings. That was the importance of having the adults at organizations talk to their youth that are in those organizations, of orienting them to the work. So we're not just kind of thrusting youth into it and dragging them along for the ride. So I could really understand what was going on. I could be here and articulate it to you all today. So all the things I talked about, that go around question, the ground rules, the importance of interactive elements for youth engagement and adult engagement as well, it's all been how we've been able to have such successful intergenerational practices and communication. And it's really how we've been able to move forward. So when we're talking about things like the go around question, which we do at every meeting, and we're thinking, well, should we cut this out for time? We have to really understand that all of those community connections are a part of the work and a part of ensuring that we don't just start stringing youth along, and that we're actually making sure that everybody is an active participant and everybody's voices are heard. And now I will pass it to Lalu.
Thank you, Michaela. That was incredible. Just to introduce myself really quickly. Good morning, everybody. My name is Lalu Ogane, and I'm a senior at Decatur High School in Atlanta, Georgia. I love playing basketball and running track, and I'm someone with an intense passion for promoting equity and advocacy in my community, whether it's mental health related, homelessness related, or any different facet of life in my community. And I'm an advisory council member from Vox Atlanta's youth staff. Over the next 15 minutes or so, I'll be speaking about my personal journey with mental health advocacy and my role in this project, emphasizing the facets and importance of mental health while in tandem reviewing some of the steps that this council has taken to help combat Black youth mental health issues in Atlanta. So, my journey as an advocate for youth mental health began in the fall of 2022 with a Vox-sponsored group called Speak Up Decatur. The basic facets of what I learned through Speak Up Decatur are on the right: focus group facilitation, problem solving, community service, and data analysis, skills that are very helpful in the world of youth mental health. However, there was much more to what I learned as a part of Speak Up Decatur. I learned about facilitating safe and open conversations and what makes up mental health for youth, and exposed me to a myriad of perspectives that make up what mental health means to me today. It was especially important to me as I was talking to many youth that I actually knew, making tangible change inside of my city. After Speak Up Decatur, I was invited by my mentor at Vox, Ms. Rachel Wallet, to join the Black Youth Mental Health team at Morehouse School of Medicine as a representative from Vox, taking on another position that could lead to tangible change within my larger community. So, let's talk about mental health. Some of the key words associated with mental health are depression, anxiety, suicide, disorders, but mental health is a lot more than that. So what does mental health mean to you? Take a second in your head to generate a couple of words or maybe a statement that encapsulate your definition of mental health. Everybody has a different definition, but it's important to make sure that everybody in the audience, everybody alive, honestly, has a grasp over what mental health is to them. Mental health has many definitions and perceptions. For me, mental health is being in touch with your emotional, physical, and social well-being. Mental health care includes not only being able to reflect on who you are and access activities that help you, but also having people to talk to and resources to turn to in the event that you need them. Mental health is much more important than it may look to the naked eye, as mental health crises can happen to anyone and it affects how we think, feel, and act every single day. Mental health holds a special significance to me, and I've been incredibly excited to aid in these projects as a youth advocate. From when I joined the team, it was apparent that we were determined to do meaningful work and implement change-making policies. Personally, I had goals of creating policy that ensured at least one student, just one student, gained access to crucial mental health resources they would have otherwise been lacking. For me, change is incremental, and helping one person at a time is my proverbial stepping stone to making a difference. So some of our first early goals at our first meeting can be seen on the left: undoing adultism, having different perspectives, and learning to release the power for greater collectives are some of our goals. Some of our larger goals were honestly just trying to make a difference in my community, just as I said a minute ago. Normally, as one of few youth in an adult-dominated team, it's difficult to get your voice heard, as virtue of being less knowledgeable on many subjects and being generally underestimated, as Michaela went over. But my experience with the Black Youth Mental Health Advisory Council has been far from that. As a member of the council, my voice has been valued, and it's been reiterated that I bring a unique perspective to this team. As the council progressed, we began to create a policy timeline for progression and implementation. An important goal for us was to get feedback from real youth in the community via the form of focus groups. Focus groups were co-sponsored by Vox and Voices for Georgia's Children. We led 3 focus groups, 2 for the age group of 14 to 17 and 1 for the age group of 10 to 13, with 13 total participants. We kept the focus groups to smaller groups in order to ensure comfortable spaces for youth to share how they truly felt, promoting personal conversations and gathering valuable information in a way that may not have been possible in larger groups. We believe that the focus groups would be more authentic and effective if they were youth planned, youth facilitated, and youth led, as it would promote more of a genuine peer-to-peer communication. In that end, as a focus group leader for 2 groups in the 14 to 17 youth age range, I had the opportunity to co-facilitate and promote safe conversations about Black youth mental health and what it really meant to Atlanta youth, people in my peer group, unlocking new perspectives and giving the advisory council a better handle on the types of policies and spaces we should target. This is the continuation of an incredible opportunity for me to correspond with people that were in the direct group that we were aiming to help with our policy, and people that were around my age living in my city. In the focus group, we asked different questions like, what comes to mind when you hear the term mental health? And what programs at school or in your community do you think are making a difference in improving the health and well-being of students? Ultimately, we were trying to create more of an understanding of the state of mental health within the Black youth community. Some of our key takeaways from the focus group were in varying different perspectives, but they kind of all tie back into the same perspective. That youth deal with stress in different ways, whether it be family, school, work, etc. Some youth don't have a good grasp of what their mental health means to them, and they're striving to create a better one. Not all youth are the same, but underlying themes with their mental health needs resonate across communities, and the Black male mental health representation is lacking in comparison to our female counterparts. So some of our key takeaways are on the screen. Different people, different quotes, said a lot of different things. We were really appreciative of them taking their time to share with us what they thought about mental health. To tie this back into a personal reflection on what this means to me, Black youth mental health is a theme within many of my social circles. My family, my 2 younger siblings, my African father who has a somewhat limited perception of what mental health means for youth, my close African American friends who I've seen struggle with family and school related issues without being able to truly take advantage of the resources available to them, and within myself. Having the opportunity to take a deeper dive into what constitutes Black youth mental health and how I personally can contribute to changing lives one step at a time has been nothing short of awe-inspiring. I'm proud to be part of a team making such a difference in the lives of youth in my community, and I'm excited to continue my work with an incredible team into the future. This project has been nothing but incredibly rewarding for me. It has inspired me to continue on my path of advocacy. Stay tuned to the waves we continue to make. Thank you for listening, and now I'll pass this to Jeremiah.
Hello. My name is Jeremiah Mitchell, and just to be mindful of time, I will be kind of cutting my introduction brief. But my name is Jeremiah Mitchell. I kind of joined this project through actually a recommendation from one of the other members of this as a youth AC member. And then I've kind of graduated into being an internal team member. I created the video that we saw earlier, much like how I've created other videos in the past that have advocated for mental health. So around the time that I joined, we were talking more about implementation, right? The implementation process for us was a little bit different because we had so many youth that didn't understand kind of the policy assessment framework, which you see on the screen. We decided to break it down for them and practice it more. So the first part of the policy assessment framework is the policy identification. We want to identify what exactly that we are doing, whether it's making a law, whether it's strengthening a law, or even creating a new program. We want to identify the actual action that we're taking. The next step in phase 2 would be looking at the feasibility and the appraisal. Feasibility, as it says on the screen, is how doable is this process that we're going to do. So what does it want? Not only what does it take, but let's analyze, does it cost money? Is it sustainable? Is there enough backing behind it for us to actually use it? Will it actually make an impact from the appraisal standpoint? Will it actually affect Black youth mental health? We want to make sure that whatever policy that we identify is not only doable by any sites that we decide to implement it in, but also that it will actually create a positive effect on Black youth mental health. In the third phase, that's when we start to think about the strategic reform and implementation process, which is kind of where we are right now, where we start to think about sites that we want to put them in, the places that we want to target, and also the way that we will, again, implement these processes. Now, the way we kind of got to our policy, it was more of like a 4-step process. We first got to hear a lot from policy experts. The Voices team, as mentioned before, helped us, presented us with a lot of different policies that were already relevant to us, whether they were, like I said, laws that were already in place, laws that we could make, organizations that we could make, organizations that are already in place. We use those to kind of as our baseline to get an idea of what we want to do. After that, we led focus groups, like my partner Lalu said, to determine kind of some common themes that we wanted to address within this policy. So we went to the youth to get the youth voice to understand what exactly do we need to attack with this policy. Once we did that, we also got feedback from our own council members on the policy recommendations. So now that we had this research backing, we also had the policies that we were recommended. We took both of these and took the feedback of our council members so that we could be able to draft a policy in this last part from the lived experiences and the learned experiences to create the policy that you see on the screen, which is to increase the opportunity for peer-led / informed mental health wellness activities. So we want to make sure that with this policy that we are implementing, that we encourage more peer-led mental health and mental wellness activities. Like it says here, our aims are really to, 1, create environments that build connection. it's so much easier for us to connect with people who are on the same plane with us, that are going through the same experiences that us, and that in the most part are the same age of us, than it is trying to talk to an adult or maybe somebody else that is seen as a superior, quote unquote, than us. We also want to revise existing policies while doing this. It makes it a lot easier for us to revise policies and to look over what we already have in place so that we can be able to use that as well. On top of that, it lets us use workshops after hours outside of school time. So when we're looking at implementation sites, we want to make sure that this is not just on one place, but that it's multidimensional, which is why you can see that we selected schools at a time locations, but also mental health clubhouses, all places which one, Black youth are, and also where mental health struggles may happen, and where we can make an impact positively on mental health. A lot of the wellness activities that we are proposed were a little different. One, we want to have youth in the seats of power, right? We want to put youth in a position to make decisions on their own on how they handle mental health within their schools, within these clubs, within these out of school activities. We want to make sure that no matter what, that youth has the power to be able to have their voice heard. Number two, we want to make sure that they can lead their own mental health trainings so that they can be, like I said earlier, on the same playing field and help each other out, and not always have to rely on the help of an adult until it's absolutely needed. And lastly, we want to make sure that there's youth trained as community health workers, just like how there are therapists and we have, I guess, your guidance counselors and other people empowered. We want to make sure that youth are empowered to help in the same way, even if they may not have that degree or went through the same schools as some of these other professionals. You want to make sure that youth feel empowered to do that, but also that they can work in tandem with these adults as well. With these in mind, I would also like to pass this now to Mally to talk about some of our early accomplishments with the council.
Thank you, Jeremiah. So to wrap up, so we at least have 10 minutes for Q&A. Some of our early accomplishments have included active engagement through over 10 meetings, our amazing focus groups, and youth adult partner sharing trainings. Some of our learned lessons have really been about the idea of youth engagement versus youth participation. You know, in the beginning, we found it easy to engage youth, but found it harder for them to participate. So finding those modes of communication that work best for youth, and really being able to build those genuine relationships where they feel comfortable to speak up in these spaces. And you can see a couple more here. And then, you know, what's next? Some of the things that we're working on next is tailoring our policy to our implementation sites, adding on an AC member from the school space, hopefully from district level, to give insight for our school site, a youth-led event, and then, of course, the implementation of policy in these 3 sites, which can look different. And we're really excited for what that will look like. And as you can see, youth engagement down the side, because it will be a part of every step within our next processes. And just the screens to look at some recommendations and implications for future research include, you know, how can we shift the narrative of policy to be more positive instead of a reaction to a crisis? And where does your project fall on the ladder of youth participation? And here we have a QR code with a 1-pager for our project. So feel free to scan, and we'll keep that updated as we go along to keep you along with us for the journey. We just want to thank you all for being here with us today, and we will open the floor up for questions and answers.
Back on. Wow, wow, wow. That's all I can say. This was such a phenomenal presentation. I've been doing community-based participatory research my entire career, which spans over 20 years. And I'll just say that you all are doing it the right way. And this is so impressive. Excellent job. I'll give you some more kudos later, but I want to get to some of the questions. We have one question in the Q&A that I'd like to share, and then please add more questions to the Q&A, and I'll read them aloud. So the first question for the team is, do you all have any recommended materials to read or watch in order to learn more about adultism and youth rights? And anyone from the team can can respond.
I'll actually pass that question to Michaela, but Vox does have amazing resources, so I'll let her highlight that a bit more.
Wonderful. Okay.
Okay. Yes. So if you were to, I know Vox has a lot of things in our archive. I don't know if a lot of our youth engagement tools and adultism resources are available to the public, but you could reach out to Vox ATL. You could go to our website and find our contact us page. And from there, we can share resources with you. But I also recommend just talking to young people that you might work with about, how do they experience adultism in their lives.
Wonderful. Thank you for your responses. We have another question from Sarah Reynolds. The question is, are there other youth engagement activities that you all recommend to build relationships with youth in your communities? Would anyone like to take that
I could
question?
definitely say, in my experience of working with youth, I'm an English major and I'm studying to become a teacher, actually. One of the things that we talked a lot about in my educational psychology classes is really, like Michaela talks about, is leveling the playing field. So doing activities that are like group work, doing stuff that is very team building, whether it's going out and doing an activity, even if you're doing schoolwork, but you're doing it outside, making sure that you're not only asking questions that are more personal, but not, too personal, but finding ways to relate to the youth in any way possible. So whether that's, finding a game, kind of starting an argument if you need to, about who the best rapper is. Things like that help to build relationships and add more youth engagement to the community.
Mm-hmm. Okay.
Yeah, and just to piggyback off of that, another thing that Vox does have is a list of different icebreakers, go around questions, different interactive activities for both in person and virtual.
Wonderful. Thank you all for those responses. One more question here, excuse me, from Mary. Are you all available to attend virtual support groups in communities to share your how? I love that.
Sure, that's
So firstly, sorry, you got.
Jeremiah. Okay, I was gonna say we're definitely interested in being able to share and help out where we can. So we can leave our contact information, so you can shoot us an email and we can set up and look how we can set that up.
Wonderful. Let's see. That looks like it. That was the last question. Any other questions from any of the attendees before we move on? I have one question. If I don't see anything pop up here, let me just check the chat. No. Okay. All right. My question to you all is, how has this work sort of informed your lives, your professional lives, and your career trajectories? Because this is very powerful work, engaging communities and working with youth. It really changes your life, and it changes the lives of those with whom you work. And so I'm just wondering, how have you all used what you've learned as you've been doing this work to sort of inform your careers and your trajectory and where you see yourselves 5 to 10 years from now?
I think that's an incredible question. I'm not sure if anybody wants to tackle this after me, but I'll definitely go first. Before doing this project, honestly, I had kind of thought of mental health as, something that I love talking about, something that I love thinking about with friends, people in my community, and definitely something I wanted to be cognizant of, but probably nothing that would actually take any type of role in my life post-high school, post-college graduation. I'm planning on, kind of traveling across the country this fall. I'm going to California. And honestly, before this project, I probably would have thought of mental health as something of an afterthought when I was there. But being a part of this project, having the opportunity to truly research what mental health is, what it means to people, kind of the pervasive issues of mental health inside of my community has really inspired me to keep on going, keep on doing what I can, even when I get out to college. You know, I want to definitely talk to high schoolers, talk to middle schoolers, do things with the youth, just to make sure that, you know, for people who look like me, people who aren't really represented, that they have somebody to talk to, that they have a voice that's telling them you're not alone. And so I definitely think that this project has made me more of an advocate and more of somebody who wants to be available for others.
Thank you, Lalu. That was wonderful.
Piggybacking on Lalu, I would say it's similar for me. Like I said, I want to kind of spend my life working with younger youth. So being able to be equipped with the tools to be able to see kind of early signs of mental health struggles, but also be able to help with that before it gets more on the serious end. I definitely see it affecting and helping me in my future endeavors.
Excellent. Thank you, Jeremiah. Any other thoughts from the team? If not, I will wrap us up.
I do see one more question of how do you increase youth engagement? Yes. And I just want to say, I really think it starts by confronting those biases that you might have and really putting yourself in the mindset of, you know, children also deserve that spot at the table. Young people deserve to be a part of the conversation. We don't just inherit this world, we still live in it too. So I think it's very important to have that mindset going forward. And as long as you have that energy, then that is going to directly translate to young people. Like, I feel it every time I step into Vox. I know in that place, my voice is welcome and I will always deserve a seat at the table. And as long as you're putting in those steps or creating that space where youth voice is allowed at kind of every step, and you're not just kind of like going to the next step and then not really telling young people what's going on, and then you're just kind of like telling them, oh, this is what we're doing now. As long as you're including them in each step or in whatever operation or organization you're in, just including those young voices and asking them what they need, and including those tools that I mentioned, that go around question, interactive elements. We're always trying to find, like, we found a way to make policy assessment framework interactive somehow. And we shift from different modes of learning, from small groups to visual to auditory, doing different things and kind of trying to get very minute about every detail you're doing is really what makes youth engagement work.
Wonderful. And on that note, thank you, Michaela. On that note, I will wrap us up by thanking our phenomenal speakers, our phenomenal scholars here today. And we just really appreciate your time, your experience, your expertise, and sharing this important work with us. And I know you all are going to change the world. I just know it. And to those of you who have attended today, thank you so much for being here. Our next session is going to start in 30 minutes, and we'll hear from Dr. Tanisha Foster Freeman, who will be exploring the individual, interpersonal, and organizational factors contributing to mental health disparities among Black and Brown youth and young adults. You'll discover actionable steps to foster caring and equitable systems in collaboration with our communities and aim to eliminate disparities and create meaningful change. I'd like to remind each of you to complete the feedback survey, which will be available at the end of the day. Thank you again so much for joining. Enjoy your break, and we'll see you all soon. Take care.
Thank you so much, Dr. Coker.
The speakers are on for a second. That would be great.